Hi guys, happy Saturday morning. You've caught me here. I've been awake for a few hours, but I'm just having my first coffee of the morning, and I really just wanted to come on here and offload a little bit. I think I feel, I don't know, I suppose I've got a few fears and concerns, and whilst I really don't want to worry other people that might be going for this surgery or have just had this surgery, I don't want to scare anybody, but I'm kind of, you know, I'm in pain, right? So I've told you I've had this pain, and it'll be Thursday it started, so Thursday, 7, 8, 9 days today I've had this pain, and the pain you can almost handle, you can almost get used to it, you kind of live with it and you take your medication, whatever. But the fact it stops you from doing stuff is pissing me off more than I think I give myself credit for. So yeah, I'm not in a good place today, and I think because the ultrasound came back with absolutely zero, and I know a lot of people have asked, did he check this? He checked everything inside me. You know, he checked my gallbladder, my liver, my pancreas. He went across to the spleen. He looked at everything, and I never really understood the human anatomy, I guess, when you look at your body. And it was only last night when I was researching, what else could this be then? You know, if this isn't gallstones or a gallbladder attack, what is it? And I was thinking, you know, I was looking at my body and thinking, well, my stomach is this side. I know it's probably opposite to you guys. My pain is on the opposite side. So I was actually thinking, well, it's not going to be to do with my bariatric surgery. Why would it be? It's on the opposite side. And I think I'm pissed off, and I'll tell you why I'm pissed off. I know I've said before about when we go for bariatric surgery, especially on the private sector, how there is zero support, and I mean zero support. You know, the only reason I have got so much support is because I put myself out there on YouTube and Instagram, and I've gained that support through people that have been through the surgery, and I've been able to ask questions after questions and been able to gain so much knowledge about bariatric surgery, and every step of the way I've been helped along, but not through anybody at the hospital and not through any support network there. Well, there wasn't any, so that's my disappointment. I think within the NHS, I've said it before, you get quite a lot of support. You have your groups, and I know a lot of people don't like going to those groups, but you make people, you can swap numbers with people if you choose to. You can ask them then, how are you feeling about this or whatever, you know, post-surgery, before surgery. So my disappointment with the lack of support is very evident at the moment. And the fact that I'm 11 months post-surgery, I paid a lot of money to have this surgery, and I kind of knew that there was, of course I knew, you sign a piece of paper to say, you know, this is what this money is paying for. So I had my surgery, so many follow-ups, blah, blah, blah. But I suppose what I didn't realise was, if there was any complications past your follow-ups, do they give a shit? Not really. And that's really got to me, I think, that yes, Dr. Ramus can see you at the end of February, and it'll cost you 150 quid. Well, let's fucking hope this isn't anything serious, right? That's where my mind's at the moment. I'm a bit angry. I'm a bit angry with the whole system, and, you know, I'm sure they have a lot of patients and da-da-da, but I'm not the sort of person who's jumping in and going back there every 5 minutes unnecessarily. I haven't fucking done any of it. So to now want to be reassured over this pain, and I think my problem is right now, today is, I went to bed last night and Googled, and I know it's something that we shouldn't do. Dr. Google is good in some respects, but it's also not good, and it probably hasn't done me any good, because what I didn't realise also is how many complications can come alongside this surgery. You know, you get told, I remember my initial consultation, and he was saying, you know, the mortality rate was 1%. Only 1% of people die in the operating theatre. And I was like, blimey, that's not bad going when you think about caesarean sections, or you think about, you know, a lot of other complications or death that comes with. So anyway, I kind of went into it with my eyes wide open, or so I thought. I thought I was well prepared, well researched, and all the rest of it. But as things are going along, I guess I haven't been. I don't want you to think for 1 minute that I'm regretting my surgery. I'm not. I'm in pain. I've had a constant pain for 8 days right now. So I kind of just need to document how I'm feeling, because this is what this YouTube is all about. for me to look back on and say, okay, that's how you felt at that point. But I am, yeah, disappointed with the hospital. So yes, I can see him at the end of February. She did talk about, she said you can go to your GP and get some, I think it was choose to pass something, I don't know what it was, basically maybe where I could skip the money side of it for the private sector. So anyway, as I told you yesterday, I've got an appointment on Monday, and stupidly what I've done is I've started to read complications. I'm going to read a few out to you, and you know, I'll probably put up here, anybody who's a bit concerned about this surgery perhaps shouldn't listen to this, because these are the things that could effectively go wrong with our bariatric surgery. I don't even know if I'll post this yet, but I'm just a bit pissed off. And you know, the NHS is in such a state in this country, which is our National Health Service, for those of you who don't live in the UK, that, you know, I did try and see a doctor last week, and I'd just done my makeup and I had some perfume on and I had a smile on my face, and actually the receptionist there didn't think I was in enough pain to have an emergency appointment, and that really pissed me off. So I'm so disillusioned with the whole setup, NHS, receptionists, doctors, pharmacists that just don't give a shit. I really am. I just, if I didn't have to use them, I wouldn't. And I think another reason I'm pissed off is prior to bariatric surgery, I wasn't at the doctor's, ever. So yeah, I'm a bit fed up with it, if I'm being honest, that I now, you know, I now see a doctor more than I've ever seen, and I can't stand it. I can't stand the waiting up there. I can't stand the way some of the doctors treat you or speak to you. They're busy, I totally get that, but we're still human beings with feelings, and we're in pain or hurting. You know, majority of us wouldn't be up there unless we absolutely had to be. So yes, my disappointment is real, I'm afraid. I'm having this is probably going to be my worst YouTube to date, so okay. Weight loss surgery. I'm going to read a little bit what I've found on the internet, and you know, I'm sorry if this scares anybody else, but this is where I'm at the moment. It was introduced in the States in the 60s. Over the next several decades, the advancements of surgical instruments and introduction to laparoscopy resulted in the RMY, gastric bypass. So this has been going since 1960, so they know what goes on. I didn't know that we can get something called an internal hernia. That hasn't actually come up. We can get something in a gastric bag, confirming a diagnosis of internal hernia. I'm not saying I've got this, by the way. This is just what I've been reading lately, and it's kind of worried me a little bit, or opened my eyes into realising there was a lot more to this surgery than I realised. I thought I'd done my research. Clearly I hadn't, because I didn't. These are rare cases, don't get me wrong, but when you're in pain, you can't see a doctor and the surgeon doesn't give a shit. Of course your mind is jumping to bits and pieces. Anyway, the diagnosis of an internal hernia after a gastric bypass can be challenging. Patients may report recurrent non-specific colicky mid-epigastric or pain. Occasionally the pain may radiate to the back. Patients may report leaning forward to alleviate the pain. Sounds similar, right? You can get something called an obstruction of the biliopancreatic limb. Among the commonly performed bariatric procedures today, one of the complications unique to malabsorptive procedures such as RMY gastric bypass is obstruction of the biliopancreatic limb. A common cause of BP limb obstruction is an internal hernia. Again, so you're like, what the fuck's an internal hernia? I didn't know anything about that. I mean, I don't know how common this could be or how rare, but I'm suddenly reading, you know, all sorts of things, and it's not easy to diagnose. So the fact that my scan has missed something, this is where my brain's going, right? So obstruction of the biliopancreatic limb, among the commonly performed. Okay, I've just read that. As an anastomotic complications, there are a number of complications that can occur at either the gastroduodenostomy, or these include leaks, obstructions, bleeding, ulcers, strictures, and other complications. The timing of such complications varies between patients, but in general, early complications include a leak, bleeding, or post-operative edema, which I didn't have any of that. You know, I'm 11 months post-op, so yes, I'm surprised at this, because not at any point did my surgeon, dietitian, nurses, psychiatrists that you see before bariatric surgery, one, talk to me about the possible risk of reactive hypoglycemia, which I'm having tests for, as you know, and nobody said anything about this. I thought the complications would be feeling sick, having the normal. And I guess I've had a really smooth ride of it up until this point, and suddenly there's a lot of things happening all at once to me, which is why it's just, yeah, it's getting me down a bit, guys. I'm not going to lie. I am going to be, I said to you from day one with my YouTube that I'm going to be raw and honest with you, and this is where I'm at. So I'm sorry this isn't a more positive YouTube. It's my cat. Yeah, I'm sorry this isn't a more positive YouTube, but this is how I feel today. You know, just reading again, it could be a stomal ulcer. There's all sorts of things that could go wrong. And the sad thing is, though, when I go and see my GP on Monday, who's not bariatric trained, she's going to basically go, well, I don't know. I don't know what tests she'll send me for, whether it'll be blood tests or scans or, you know, but I've already had an ultrasound. I'm fortunate in the sense that I don't have to use the NHS in that respect. I have to go to my GP who refers me. We have private medical health. So the fact that I got in and had my ultrasound within the week was amazing, but that's purely because we pay for that. We have a private healthcare. So it's back to the doctor's Monday, and hopefully, again, whatever I need to do test-wise, we'll do it on our private health, so it will be quick, and I will keep you informed. And it might be absolutely nothing. I know it's nothing. It hurts. You know, I've got this pain that made me scream out last night when I twisted in a certain way. So yeah, I can only hope that I don't need any other intervention, that maybe, I don't know, maybe I've got an infection and it needs to have some antibiotics, but it's been 9 days now and I haven't got any answers. So I'm pissed off about that, and I'm not any better. So sorry. I hope Saturday is better for you guys. I'm sure I'm going to have a shower. I'm going to pull my big girl pants on, take some paracetamol, and I'll be absolutely fine and I'll bounce back. But this is me, this is real, this is raw, and I hope you're all really well, healthy and happy. And I'm sorry for moaning and grumbling today, but it's a case of this is me.